Hello, I'm Dr. Ajit Saigal. I'm senior orthopedic surgeon based at Varanasi. And in this today's meeting, I'm going to talk about aging and the physical fitness. So, as you all know, that exercises and workout, they have a positive impact on the molecular level, cellular level, and at the tissue level. Aging causes a decrease in the potential for the cell proliferation, and that reduces the number of stem cell and reduces the progenitor cells in the tendons. So tendons in response, they become weak. The exercise can induce the strength in the tendon because of the good collagen and boosting the tendon strength. The moderate exercise can also enhance the quality of the tissue produced, so that the tissue, they get a good healing atmosphere during the tendon injury. And the physical exercise and fitness activities, they have a positive effect. They have a positive role in maintaining cartilage and bone health. And European Society of the Clinical and the Economic Aspect of the Osteoporosis, Osteoarthritis, and the musculoskeletal diseases, they recommend the high protein diet and physical exercises so that the bones are stronger and muscles are stronger and the tendons are stronger. One by one, I will talk to you regarding the diet of the aging people. As per my expectation, age is a number. And if you forget the number and do your work regularly, do your good exercise, take your proper diet. And regarding your diet, I have got a strong feeling that the nature has given us the diet, the products of the to eat in the summer. We get cucumbers. As you all know that in summer we need water, we need minerals, and we get all this water and minerals from the cucumbers. And same way, in the winters also, we get the cereals like that, we get the fruits like that, we get the vegetables like that, which is required in the particular season, whether it is summer or whether it is winter. So we should stick to the natural process and stick to the our diet, which are available in that particular season, like summer or winter. According to diet, the protein should be the main content of our diet. But if you take a high protein and if you have a high uric acid, that causes disease gout. So you have to avoid especially red meat. You can take white meat, which is you can get in chicken, you can get in fish, and fish is the best protein available. Egg is very good, and the white portion of the egg, it has got a good amount of the protein. If you take a boiled egg, it will give you approximately 40 40 calories, and you will be consuming approximately 5 grams of the protein. So boiled egg is very, very good in form of the protein diet. The vegetarian people, they can get protein out of the pulses, the milk product like curd, like paneer, and they can have the black gram, they can have kabuli chana, they can have rajma, which contains a good amount of the, and especially the soybean. Soybean is very good. One thing I must tell you that most of the females, they ask that if I take a high amount of the protein, can I get a problem with the gout? So let me explain you one very important point, that if a female is under the menstrual cycle, in that patient, uric acid is usually not raised, but it can rest if there is a strong family history. So females can also consume a good amount of the protein, and they can take white protein in form of the meat, chicken, fish. Vegetarian people, I just suggested they can take the curd, paneer, black gram, kabli chana, rajma, and soya bean. So these are the good proteinous product which will help to increase our bone health, our muscle health, because I am conducting a bone density test for last 10 years, and it is every month available at my place. And during last 10 years, I can just give an example that approximately 33 to 37% females, especially those who are vegetarian, they are suffering with either osteoporosis or osteopenia. One thing very important for the osteoporosis and osteopenia, that you must have a proper amount of the vitamin D3, which is naturally available if you get a proper sun exposure. But you all know that most of us, we are busy in our day-to-day work, and we do our office works most of the time. The outdoor activities of the children is almost nil. They are on the computer games, they are on the TV games. So the sun exposure to the people, it has become very less. So because of the less sun exposure, people are D3 deficient. The vitamin D3 is on the lower side. And for that, if you don't get a proper sun exposure, you must take vitamin D3. It is available in form of the injection, and it is also available in form of the capsule, tablet, and syrup. And it is consumed at weekly interval, and at least 12 weeks you have to continue with that medicine, and the problem is over. As you all know that vitamin D3 estimation is very, very costly, and if you take the medicine for the whole family, it will be the same amount like investigation of the D3. So D3 is mostly, it is on the lower side in the Indian population. We must take the D3 so that we can get a proper calcium. I must tell you that regarding the calcium, regarding the osteoporosis, up to 38 years of age, we have a deposition of the calcium in our body. After that, there is no deposition. You have to fulfill your calcium requirement either by diet or by medicine. If you are taking a proper diet, you don't need any medicine, don't need any calcium. But if you don't take a proper diet, you definitely need calcium. And I will suggest that the calcium citrate maleate is a water-soluble calcium, which is good for the body, because whatever is required is absorbed, and the rest of the calcium, which is in the form of overdose, it can come out. It will not going to create any problem to the body. So next I will come to the exercise. Exercise is a must. If you take your diet 3 times a day, you take your breakfast daily, you take your lunch daily, you take your evening tea daily, and if you take your dinner daily, if it is all the 4% of your diet is necessary, then just you get confirmed in your mind that exercise is must. Whatever you are consuming, you must get burn it out. And especially in diabetic people, they should do a regular exercise. If you want to live a long life, if you want to live a healthier life, because diabetes is a disease which itself doesn't cause any problem, but the complication of the diabetes, the complication coming to the eyes, the complication coming to the heart, the complication coming to the renal problem, giving you the renal problem, coming to the neuritis problem, nerve problem. These are very, very hazardous to the body. And unfortunately, even the younger people, they are affected with the diabetes. And the type 2 diabetes is on the increasing trend, because it is said that diabetes is a lifestyle disease. You must plan your life. you must plan that this much time I have to do a regular exercise. For the diabetes who are on the oral drugs and especially on the metformin, metformin causes a weakness in the muscles. So you will feel that while you are consuming metformin, your thighs, your arm is becoming thin. That is a big problem with the metformin. Metformin is a wonder drug, but every drug has got its side effect. So if you are taking metformin, you must exercise. You should do a weight bearing exercise so that the muscles are strengthened. So coming to the what I've told you for the osteoporosis, I've told you the exercise, I have told you the diet. Now coming to another problem which is coming in a big way to the modern era, that is osteoarthritis of the knee. Osteoarthritis means there is an inflammation in the joint, and osteoarthritis affects the vertebral joint, the shoulder joint, the cervical spine joint, lumbar spine joint, and the most common is osteoarthritis of the knee. And the percentage of the osteoarthritis of the knee is increasing day by day. It is common with the females at the age of 45 to 50 years, and it is common in the males after the age of 50 to 55 years. The females, those having menopause, they get a female hormone deficiency. And because of the female hormone deficiency, there is osteoporosis, and the osteoporosis develops very fast, especially in the knee joint. This osteoarthritis is in 4 grades. In grade 1, initially there is a little pain and there is a little swelling in the joint. Patient is unable to run, unable to climb ladders. But this stage can be give you the benefit with the some drugs, but exercise helps the most. And you should do a regular exercise with little drug and it will be all right. Now comes the secondary. In the second stage, that is grade 2, the joint is becoming more disturbed. There is some erosion in the joint. The joint space in the joint is a little less, and that gives you more trouble, especially in the night and especially while you are climbing ladders and you are running. Even in this grade 2 stage, one treatment with the drugs, exercise, icing, because exercise knee joint is a weight bearing joint, and if you do a proper exercise for the quadriceps and for the hamstring, that will give a good relief in cases of the osteoarthritis of the knee, even in grade 2. And one treatment which is on the all over world in a taking a good response is a injection of platelet rich plasma. Some of the people, they believe that it's not so effective, but after a long time study, it is seen that it is effective, but it is not going to give you the 100% cure. If I talk the pain in terms of intensity, that you have come to a doctor with the pain intensity of 10, if you take the proper treatment, it will come to 3, 4. And the duration of pain is less. Initially, you were having pain the whole day, 24 hours, but after taking the treatment, the pain is just for 3, 4 hours. So this is the treatment for osteoarthritis grade 2. Now coming to grade 3. In grade 3, the people are old aged people, especially 55, 60 years of age, and the joint is swollen, it is more painful, it's not fully straight, and there is a inward inclination of the joint that is called genu varum deformity. In this stage, a special operation is done below the level of the knee joint level, and from where the joint has becoming inward, the deformity is called varus, is corrected and a plate is placed at the inner side of the upper part of the tibia, just below the knee joint. In this process, this is a joint preservation technique. In this technique, your bones are there, your joints are there, but the problem of deformity is corrected, so you will get relief. I'm fortunate enough to tell you that I have invented a plate for this high tibial osteotomy operation, which is patented by Government of India, and it is in my name, Dr. Saigal Osteoplate. This is especially for grade 3 osteoarthritis of the knee, and if it is done properly, it can last for 30 years and more. Now coming to the fourth stage of the osteoarthritis. The fourth stage of the osteoarthritis is where patient is in painful condition even on rest, and he is not able to sleep over the night. Every time there is a pain, he is unable to walk properly, he is unable to climb ladders properly, and it's a miserable condition. In this condition, grade 4 osteoarthritis, joint replacement is needed. And if a joint replacement is done properly, patient is pain-free, and he can perform all his work. So joint replacement is required in grade 4 of the osteoarthritis. Now coming to the another problem, it's a low back pain. Low back pain is very common with the old age. Low back pain is very common with the person over 55, 60 years of age, because the most common condition is either they are osteoporotic, or they are osteopenic, or there are osteoarthritic changes in the spine that is known as lumbar spondylosis. And in some cases we see, in some cases we see that patient has a history of fall on the back, but he never realized it, and now he has come after 30 years that I'm suffering with pain, and I have fallen approximately 30 years back, and that time it was not a big problem, but now it is creating problem. And when you get the X-ray of that person who is suffering with low back pain, you will see there is a condition where the vertebra are like a box. If you see from the side of your vertebra, the vertebrae are like a box, and they are at the same level. And because of the fall, one of the vertebrae is slipped either anteriorly or posteriorly. This is known as spondylolisthesis, and this is a predisposing factors of the disc prolapse. And very common is a condition where if you seeing a patient in the outdoor for the low back pain, patient is suffering for so many months, and if you examine, you will find that there is a definite tenderness at the level of L4-5 and L5-S1. And if you get the MRI done, if you get the X-ray first, then you will see the space between the two vertebrae is less, and there is osteophyte at the level of the end of the vertebra. And if you get the MRI, definitely you will find that there is a disc bulge at the level of L4-5 and L5-S1. This is the most common place to occur for the disc. And the same problem is seen in the cervical spondylosis. C4, 5, 5, 6, 7. These are the level where the maximum movement is there at the cervical spine. And at that level also, the bones are increased in the form of osteophyte. This is known as the cervical osteophytes. And there is also disc bulge at the cervical level. So there is a disc bulge at the cervical level that can, the pain can be there localized at the knee, or pain can be referred to the shoulder, forearm, and even in the hand. The patient can feel tingling. Patient can feel numbness in the hand because of the cervical spondylosis. And same way, if patient has got problem in the disc prolapse in the L4-5 region in the back, patient can have a weakness in the lower limb. Patient can have a numbness in the lower limb. Patient can have a referred pain up to toe because of the pressure at the upper level. So these are the different presentation. Patient comes with a complaint of that I have got a tingling in the big toe, and patient thinks that he is having a problem with the big toe, but no, it's a problem not of big toe. It is coming from upward. It is coming from the spine. So the proper examination, X-ray examination, and the MRI examination in these patients is very important, so that you can get a proper diagnosis whether there is disc prolapse at L4-5 level or L5-S1 level. And if you diagnose properly, and if it is the initial stage of the bulk, you can get a transforaminal injection into the disc area, and you will be relieved. This is the newer technique where there are two types of injection. One is a transforaminal injection, other is a injection into the direct into the disc. And if the disc bulge is compressing more to your nerve, you can get a endoscopic operation, which is a stitchless surgery, and it is done in local anesthesia. Patient is awake and he can tell that you are touching something, and it's not a big problem now to get the endoscopic removal of the disc from the patient. So these are the newer techniques which are coming for the spine surgery, which was supposed to be the very big problem of disc. Now, very important point I want to discuss with you, that especially in old age, what is the big problem? The big problem is fall. Big problem is fracture. So how to prevent fall and fracture? Fracture, I told you that fracture can happen because of the osteoporosis. So once you have corrected your osteoporosis by taking proper diet, proper proteinous diet, proper exercise, because if you consume a ton of calcium and don't do exercise, this is useless. You have to do proper weight bearing exercises, so that whatever calcium you are consuming, that is absorbed in the body, and your muscles, your bones, they are strengthened. So it is the one thing for this time I must tell, that proper exercise, there is no replacement for it. You must do a proper exercise. So for prevention of fall, that is a old aged person must follow these precautions to prevent fall. Never wear your pant or your undergarment on one foot. Just sit on your bed, or sit on a stool, or sit on a chair, then wear your pant or undergarments. Otherwise, you can be disbalanced because of some problem, maybe because of the cervical spine, maybe because of the weakness, maybe because of the another problem which is disturbing your balance. You can fall down. So you have to prevent. One important point, that never change your clothes, never put on your clothes while you are standing on one lower leg. Number two, while you are using your commode, you must have a strong bar support on the side of it, so that when you are get up from the commode, you must hold it. Otherwise, some person who are taking diuretics as antihypertensive, and if they are having some potassium deficiency, they will have muscle weakness, and if they will suddenly stand, they can fall down. They can feel there is some darkness in front of their eyes. So you must hold a proper support in form of a rod on the side of your commode. Another a rod in front of your shower. While you are taking shower, you must hold yourself properly with a rod support, so that you don't fall, don't slip in the bathroom. Then you must have a call bell in your bathroom. And if you are alone, living with your spouse, she is also old, then don't close the door of the bathroom. Either you use a call bell if in emergency, or the bathroom door should be open. Next point, while you are getting up in the night to go to bathroom, don't get, and your room is totally dark, there are chances that you will lose your balance. So you must a footlight in your bedroom so that you are aware where you are putting your foot and going to the bathroom. You must use a quadruped or a tripod stick while you are walking so that it is not slipped. And if you are not able to move with the stick, you should use your walker, because walker is available nowadays, which is folding type of walker. So it is not a big problem to where to keep it. You can fold it and keep it with you. So these are the points where you should concentrate, that you should prevent fall and fracture, take proper diet, proteinous diet, consume proper amount of the calcium, and the most important, do regular exercise. Thank you. Thanks a lot.